Hi, my name is Jordan Clinch. I'm a nursing student at Bergen Community College, and today I'm going to demonstrate how to change a wet to dry dressing. So I've checked my doctor's orders, I've washed my hands, I'm going to enter the room and introduce myself to my patient. I'm going to identify the patient, checking their name and date of birth and their wristband. I'm going to gather all of my equipment so I have everything ready to go. Now I've washed my hands, I'm going to don clean gloves. I'm going to set up my garbage so I can dispose of the materials I'll be using. I'm going to take my garbage bag to my table. So now I'm going to raise the bed to working height, and I'm going to take off my patient's wound dressing. Assess the patient for pain, see if they have any questions. So the patient has an abdominal wound. I'm going to slowly remove the dressing so as to not tear their skin. Observe any drainage, any odor, any signs of infection, and you're going to document these findings. So dispose of this in the trash. And now I'm going to set up my sterile fluid. So you always want to have it above waist height,
I want to see if
because anything below your waist is considered contaminated. And at this point, I'll remove my clean gloves.
go with the mask.
Put on a new pair of clean gloves. Remember, once you have your sterile fluid, you're not going to turn your back on your sterile fluid. And you never want to lean over it because then it'll be considered contaminated. So, I have my sterile drape. The 1-inch margin around the drape is considered contaminated, so you're able to touch that part. But if you touch anything within it, it's considered contaminated. So you can just spread it out. And also, you never want to shake anything around because then you'll be spreading bacteria. So you can pinch the corner, you can have the white side up. So that's your sterile drape. Now I'm going to get my bowl. Don't touch the bowl because it's considered sterile. Remembering not to lean over your sterile fluid.
One time I got
Just drop it. And dispose of this. Then I'm going to get my normal saline. Right in the bowl. And always make sure that you pour with the label facing your palm. Now I'm going to get my gauze. Just drop them on the table.
Oh my god.
And my abdominal pad. Now I'm going to don my sterile gloves. Always you can touch the outer border.
Hello, my name is Brian Gomez. Today I'm demonstrating how to do a... I know, but I control it. Because in my head I was thinking...
You never want to touch the outer part of the glove because then it will be considered contaminated.
Should I? I was thinking about that actually. But then I was like, what? I was like... Should I?
So I'm touching the outside.
Or no? Why? That means. Wait, no, what am I doing? What's the thing called?
Line dressing.
Dressing change.
What's that? Oh, yeah, I did it already.
Hello, my name is Brian Gomez, and today I'm demonstrating how to do a sterile dressing line change. So first I'm going to check the physician's orders. I'm going to make sure. Central line dressing.
Now I'm going to clean my patient's wound.
Alright.
So you have your gauze.
Sterile, central line dressing change. Central line dressing change.
You're going to dip it in saline, bring it dry, and then clean
My
in
name
one
is Brian
direction
Gomez,
at
and
the
today
start
I'm
of the
demonstrating how to do a central line dressing change. So first I'm going to check the physician's orders, make sure you ordered the dressing change for this patient. And you did, so I'm going to go ahead and get my
more
equipment, which is right here, this
gauze,
kit right here.
dip in your saline,
An extra
bring
mask
it
for my
dry.
patient. I'm going to enter the room, I'm going to wash my hands, I'm also going to identify the patient and myself as the patient, as well as make sure the table is locked. So the table is locked. Hi, my name is Brian, I'm going to be your nurse today.
And you
Can I
can just
verify
write-
your first and last name and your date of birth? And it confirms that. Okay, Mr. Alvarez, today we're actually going to, doctor ordered for me to change your
So now this is a wet to dry
central line
dressing.
Okay, do you have any questions or anything?
You're going to apply
No?
gauze.
Okay, feel free to ask me any questions.
It's dipped in
if you have any.
saline.
So my hands are already washed. I'm going to go ahead and also just go ahead and open my equipment right here. Time. Okay, use this
And you apply your dry
receptacle
gauze.
for the garbage. My sterile feet, so I want to be careful there. When I also make sure I'm moving that away.
Apply your abdominal
Myself.
pad.
Because inside
Always
the
assess the
sterile
patient for
field
any pain or
is
discomfort
not
as you're
acid.
doing this.
So here's an extra mask for my client or my patient.
And then you'll tape it.
Again, raise the tape of my working height.
Now you have changed your dressing.
Lower. Alright. I'm gonna go ahead and put the.
So return the bedclothes height with the side rail up.
Again, if for some reason there's no mask, if there's no mask or anything, I
You
wanna
can
make
remove
sure
your
to turn
sterile
head away
gloves.
from the central line. So I'm gonna go ahead and make sure this last is
Clean
here.
up your sterile
Even I can
flows.
also start helping turn this slightly if it needs to. So now I'm gonna go ahead and don my regular gloves.
Make sure the call bell is within reach and make sure the patient is comfortable. You're going to document your
The
findings,
insertion site for the central line as well as the area around it.
and you're always going to leave a piece of tape on the new dressing with your name, your
Take a
date,
look over here.
and the time that the dressing was changed, so just in case another nurse has to change
Take a
it.
look here and see if there's anything
And
that's
that is how you
obviously,
apply a wet to dry
or it's
dressing.
very obviously that